All right, good morning, everyone. Welcome. We're going to go ahead and get started. My name is Stephanie Fisher with the Education Department at MBA. Just want to thank you for coming on today. And just a couple quick housekeeping things before I introduce our morning speaker. If you could please keep yourself muted unless you are asking a question. And Linda's worked in time throughout the presentation to ask verbal questions. So please feel free to do that or use the chat feature. We also are recording, so I will send a link and also the slide deck and a couple additional forms that Linda will mention throughout the presentation. I'll send those later today in an attachment as well. So I think that is about it. Just be sure to let us know if you have any questions throughout, but I am delighted to welcome Linda Olenichek today. She joined the American Society of Employers in 2018 as Director of Membership Experience, and MBA has had the delight of working with Linda and her husband Ed as both members of MBA and attendees of our different events throughout the year, and they know our industry very well, so we're delighted to have Linda on. In June 2020, Linda transitioned to the role of Director, Research Services and Event Planning. And in this capacity, Linda manages the ASE HR hotline and plans all of ASE's events. And prior to joining ASE, Linda was responsible for developing and executing sales strategies throughout the state of Michigan in the toy industry. She has had a successful background in the following industries, including consumer products, professional associations, financial services, HR, staffing, and professional sports and entertainment. She brings a plethora of experience. She has experience in client relations and customer service and has built an HR department from the ground up as well. So lots to share and lots to learn from Linda today. We're so delighted to have you. Welcome.
Well, thank you for having me this morning. And of course, the MBA actually feels like family to me since I know so many of you, and I'm happy to be here and share my experience on from ASE's perspective on how to write a pandemic preparedness and response plan. So as Stephanie said, I'm Director of Research and Event Planning for ASE. And before we begin the presentation, I would love it if everybody could put in the chat function the county that your office is located in or your banking institution. I know you could be spread out in a large geographic area, but maybe just your main one. And that'll give me a great idea where everybody's from today. And as Stephanie said, we have a nice group here. So if you want to open your mic and say something or put it in the chat function, I would be happy to answer your questions as we go along. And of course, I am not an attorney, so this is not legal, health, or safety advice. So I see we have someone from Jackson County, Ottawa and Kent counties, Hillsdale, Jackson, Lenawee, Calhoun, Livingston, and a mortgage office in Oakland. Our company is located in Wayne County, currently in Livonia, but we're moving to Troy, which will be, of course, Oakland County. So terrific. And the reason I had you put in your counties is because the executive order and the regions in Michigan vary depending on where your county is. So I wanted to have us all put that out there so we can see where we're at geographically. So let's begin our conversation on preparedness and response plans. Of course, some people call them a guide or a playbook. They're for your organization to use during any emergency. So of course, we've received, as we said, I head up our hotline. One of our member benefits is they can call us basically Monday through Friday, numerous times a day, unlimited times to ask their questions. So of course, we received a lot of questions about why does my company need to have one of these? If we've never closed, obviously you're an essential industry. You may have never closed your lobbies even due to your geographical area. So we never closed. Do we even need to have one? And do employees and customers need to see it? So per the executive order, from Governor Whitmer, it does state that if you are open, you are reopening within 2 weeks, you do need to have one. It needs to be consistent with the OSHA recommendations on how to open a business. And yes, it does need to be shown to your employees, your labor unions, and your customers. So I know some financial institutions put it up on their website. Some also have an area where you could say, if you want to see it, please request and email somebody. And some organizations have even created a quick reference. In addition to the larger plan, they create a quick reference guide for their employees. So you can do a couple different things. But of course, the definition seems very simple. Your organization's effort to maintain employee and customer safety and health while also maintaining business operations. Sounds very simple, but as you see, once we dive into it, there's a lot of pieces that go into your plan, but I'll try and break it down for you today into manageable parts. And again, please don't hesitate to put a question in the chat function. So I'm going to give you all a moment to look at these words and think back to January and February of 2020. And did any of you read these words and think, did you use them on a daily basis? 6 feet apart, social distancing, response plan, CDC, COVID-19, screening your employees. I know I certainly did not use them. And some days I feel like I use them on an hourly basis as I'm talking to members. I had several conversations already this morning with members in regards to things that we'll talk about today. You know, do I need to quarantine my employees after they return back from vacation? If I put them on a temporary leave, you know, how do I recall? There's just so many questions out there. And right now, all of these words seem to be part of my daily emails, policies, and procedures. So in the chat function again, if you could answer yes or no, did your organization have a general emergency response plan? It might not have been a pandemic response plan, but one that was geared to any emergency that could happen. As you could see, some of our members in Midland, while going through a pandemic emergency, also had the floods. We had one member, thankfully all of our member organizations were safe, but they had a few employees that literally had 6 feet of water on the second floor of their home. So, you know, going through a pandemic plus that, it's just a little overwhelming to say the least. But let's start to review what the steps are to create that effective preparedness and response plan. So it looks like we had some people who had an emergency response plan in place prior to COVID-19, but I'm going to review some of the key components of a plan. And some of these are part of the executive order that is out there by Governor Whitmer. So you must create a task force that's going to evaluate and continue to monitor any ongoing emergency. You'll want to designate a workplace supervisor or worksite supervisor as a contact for your employees to rely on during business hours. Of course, you'll want to conduct a risk assessment, but not only on your work environment, but on your jobs. So, of course, you want to develop and communicate your policies and procedures. And this would include any updates to some existing policies. You might be reevaluating your leave policies right now, your cleaning procedures, and of course, we all have now PPE and social distancing policies. So you'll want to make sure that those are communicated. And of course, you want to train your employees. Some people have been doing virtual town halls. You may be doing it in groups of 10 or less, or you can do a combination with some on-demand videos. And you need to make your plan available, as we said earlier, per the executive order, to your employees and your customers. And your task force is going to continue to monitor and review the emergency. So now what goes into your plan? So as we stated earlier, per the governor's executive order, your plan in place, and it outlines that you must have that task force communicated, who's on that task force, and your workplace supervisors. And also a response plan in place shows that your organization is committed to planning and preparedness that of course are critical in mitigating the impact of any emergency that's going to happen to your organization and to its employees, and in your case, to your customers. So again, as I said earlier, you do want to make sure that it's available to those stakeholders. And it provides a series of recommended best practices. Yes, you'll get a copy of the present. I will see if Stephanie can send that to you right now. I wouldn't be able to on my system because I have the slide deck up, but we'll see if Stephanie is available to send you that. So again, a response plan is a series of recommended best practices dealing with various health, safety, and environmental measures. Again, it's designed to provide a model plan necessary to, of course, meet state, federal, and safety compliance standards while operating during an emergency. So as we saw, we're all in different counties. Even your local jurisdictions will have different governing directives during this pandemic. And then the assigned task force will continue to review and evaluate not only on a country level, we just said state, region, county, and city requirements, and of course then clearly communicate them to your stakeholders. So first we'll dive into task force and workplace supervisors. So in your plan, it's important to communicate who is your task force and who are your workplace supervisors. And if any changes occur while you're going forward, make sure you inform people of the changes to who those people are. One of our members I thought was a great idea on one of our roundtables. Their task force, what they did is break it down into pieces. So one person's in charge of monitoring the county and PPE. Another person on the task force is in charge of the state of Michigan and cleaning supplies. Another person is in charge of federal governing directives. So you get the idea. I thought that was a great way to do it so that each person has a focus, and when they do meet, they can bring back any changes. And sometimes things are getting rescinded. So things that were in place, you no longer have to do. So that's also something to monitor. You should also include their contact information, especially if in certain situations you might have people working at different hours. So you want to make sure they have ways to contact the task force. And also remember, your task force members should represent your entire workforce. You don't want it to be all managers at the same level or senior leadership at the same level. You want it to be a combination of everybody on your team. So that way you get a good prerogative of what goes on in your day-to-day operations. And also senior leaders need to buy in. This is something we're always trying to get, right? Senior leadership to buy in, but they should understand that the members of this task force are going to need to continually meet and monitor the ongoing emergency and make recommendations as necessary. And there could be some cost involved in these decisions. So that's why you do need to get senior leadership's buy-in. And there is a difference between your task force members and your workplace supervisors. So your workplace supervisors must be identified and present during the hours of operation. So when you're open. And it's important to note that if you ever have a situation, I'm sure it's rare in the banking industry, but if you have a situation where someone's working alone, that person can be designated as your workplace supervisor, just so you know that. You don't have to have additional staff on board just to be a supervisor and to be the employee. The role of this person is to be available during business hours to your employees so they can answer any questions related to your COVID-19 response plan. And it gives them an additional contact beyond their direct manager and their HR supervisor. This also helps to keep everybody consistent, maybe, keep some rumors at bay if there are any, and to keep everybody informed. So of course, there's a lot of responsibility on your plate right now in getting everything out there to your employees. But everyone in your organization must do their part and are expected to abide by your response plan that you publish. So for supervisors and managers, it's important that they, of course, set a great example by following everything outlined in the plan and address any employee concerns or questions through your proper channels. It's very important to train your managers on what's new, because you want to make sure your management knows to follow reasonable steps. You want to avoid discrimination and failure to accommodation claims. So a good example that you can give your management team is that, for example, the EEOC guidelines allow us to screen our employees. You can come in, you can take their temperature, you can ask them some symptoms questions, but managers need to avoid violations of ADA and going and asking anything off of that screening questionnaire. Employment law compliance, I can't stress enough, remains very critical right now, especially with all the different leaves going on and the different situations that are happening due to the COVID-19 pandemic. But of course, your employees have a lot of responsibility in keeping your environment safe and healthy. So they can do so by, of course, reviewing any new procedures and policies that you put in place for their workplace, but also by practicing, of course, good social hygiene, social distancing, using PPE equipment, knowing the symptoms of COVID-19 and staying home if they are ill, and of course, following all the policies and procedures that you put out there. So I thought this might be a good time. I know it's a lot of information, to see if anybody has a question of what we've reviewed so far. So you can feel free to put it in the chat function, or not sure if you can unmute yourselves, but I'm happy to hear your voices too. So I'll move to the next slide, but if you have anything, feel free. So I'll give you a second to take a look at this list of policies and procedures. I think there's about 18 different ones that can go into your response plan. So your policies and procedures, again, as we said earlier, establish boundaries, they establish guidelines, and of course, best practices within your organization. And again, it outlines the responsibility of both your employees and your employers. So you can see there's a lot of different things there that you may have not had before. The contact tracing policy, screening questionnaires, isolation policy. These allow you to communicate to your employees specific methods that are in place for your day-to-day operations of your organization. And at the end of the presentation, if you want to make a note of a certain policy or procedure that you'd like me to open up and show you, please do. And I can go right to we have a contagious disease and pandemic toolbox toolkit that we created for our members. And it has over 50 different documents and 50 different links for them to utilize. But I'm going to discuss just a few of the policies that seem to be top of mind for our members and where we get the most questions. So for employee screening, obviously you've remained open, and now this is something that we're asking employers are being asked of to do. So in the chat function, if you could put in, are you letting your employees self-monitor prior to coming into the office? Or do you have a staff member monitoring them as they enter? And you can type that into the chat function for me. And if you're using an app, feel free to put down the app that you're using. We are self-monitoring at ASC. We are working remotely, but sometimes going into the office. So we're self-monitoring, and we too, Becky, are using Microsoft Forms. And if anybody needs a demo on how to create a Microsoft form, I'm happy to do so. We have a member using it. They have over 350 employees in a manufacturing industry with 3 different shifts, and it's working great for them. So they have a Microsoft Forms creates, for those of you who haven't used it, it creates a QR code for every form that you create. They printed off the QR code. They gave it to all 350 employees, and they can scan that with their mobile device before they come into the plant. They did just make a large purchase, though, of a camera that takes the temperature of their employees as they walk through the door. So they did do that in addition to the Microsoft Forms. But I'm happy to send everyone a tutorial on how to create your own Microsoft form. It's a really nice product, and if you're a Microsoft based software platform, you already have it, so there's no cost involved. One of the other things that we're getting a lot of questions on is contact tracing. I probably never even heard of this terminology back in April. I don't know about the rest of you, but a lot of people want to know what it is. How do we handle it? Do we have to do it? We recently had someone who had a teller through their drive-through become tested positive, and they wanted to know if they had to contact every single customer that came through the drive-through line. So we relate it back to what the CDC defines as close contact. So they define it as any individual within 6 feet of an infected person for at least 15 minutes, starting from 2 days before the illness onset. So in this case of the drive-through, they did not have what the CDC defines as close contact. They have what the CDC defines as casual contact. Now, you could make your best effort and alert everybody who came through the drive-through. According to the CDC, it was not close contact, so you would not have to do it. Plus, of course, you had barriers. You had many control barriers in place with the drive-through versus an open window. It's up to you if you wanted to go through and do that contacting, but it's not required by law. But keep in mind that your daily screening records would be very helpful to know who was in the building that day. So in this case, she or he, the teller, may have had more contact with employees at a less than 6 feet distance for more than 15 minutes. In that case, those employees would have to quarantine. And our toolkit has a questionnaire for both employees and visitors. So if you need those, just let me know and we'll get those sent to you. And last but not least, it's summertime in Michigan, and we get this question, I think, pretty much daily. Should my employees quarantine if they go on vacation? So there is no governing directive in Michigan, unlike New York. I think it's New York, New Jersey, Connecticut, and I believe Louisiana added on that if their residents visit, I think now the CDC has 33 hotspots that they want them to quarantine for 14 days. Since Michigan has no governing directive on this, we advise your organization to make your own policy on employees returning from hotspots on if they should quarantine. And things that you should do is, of course, if you are going to make them do this, you need to announce that policy prior to them going on vacation and requesting that time off. And also consider things as when they get back, are they allowed to socially distance from other employees, and can they even return from the vacation and work from home? So things to consider when you create your policy. And we recently did an article on this in our e-newsletter. So I actually gave that to Stephanie, and she'll send you the article. The article also outlined for you, if you do have to make someone quarantine, how to use their leave in the quarantine. So if they don't have any time left, what can you do? So a lot of things going on with all the policies that we've had to put in place. So your risk assessment, we talked about this earlier, that both you're going to have to do a risk assessment on your organization's environment and your jobs. And this is something your task force, your management, and senior leadership will have to do. And it really begins with your parking lot. From there, each step an employee or visitor takes in your organization must be assessed for risk, and changes need to be made to continually follow those federal and state guidelines. And of course, you can set up controls to help minimize the risk of exposure. And I put some on your slide here in regards to the company environment. Luckily for you, and the financial institutions have a lot of these barriers put in place already. But I have talked to some of our members that are banks, and they did some additional things with signage. They also removed some tables and chairs from their lobbies. They also put in directional signage on the floor so people go in one direction. So they have done some things to improve their controls. They also have put even lobby greeters in for helping direct customers. And OSHA also has a risk pyramid that many organizations are using. Obviously, it ranges from very high risk, which would be your healthcare professional, to a lower risk employee. So the lower risk employee has no contact with the general public, and they are not known to be in contact with anybody infected. So of course, once you've done your risk assessment, as we've said, you've remained open. So you've had to do these constantly with or without your customers coming into your organization. Has anyone had to make some extreme changes to their environment to create any of these controls? Just wondering if anybody out there has done anything, or, you know, I know a lot of banks obviously have glass up by their tellers and they're pretty safe, but if you've done anything interesting, please feel free to put that in the chat function. So earlier in the presentation, we talked about the executive order, and there are some minimum requirements of training your employees per the executive order. So some things that you want to think about is, what does on the job look like now? So most of your employees have been coming and going. Maybe in April, you decided to break off and say no common areas can be used. You can't use the break room or the cafeteria or the refrigerator. You might not even be making a pot of coffee anymore that people can share. So you really need to constantly update your employees on what on the job looks like. And some of your people could be working remotely. I'm sure it's not a big number, but some of them might be, or some of them might have to have been furloughed and they're coming back. So remember to always inform all employees of what's going on in the job environment. And even if they are working remotely, make sure they read up on these new policies too. And it's the most obvious and the most important consideration with this pandemic is health and safety of both our employees and customers. So improper hygiene can not only increase the spread of the disease within your organization, but it will lead to more absences and reduce productivity. So it's important that we train our employees on, I know it's hard to believe, how to wash your hands and how often to wash your hands, how to wear PPE equipment properly. And also you may get deliveries and things that you used to do without thinking about it. Maybe there's new protocols that you have in place in regards to some of the actions that you did before COVID-19. So we all know as HR professionals, it's not unusual for a staff coming to work, toughing it out, not feeling great. And right now is not the time for a staff member to come to work not feeling great or thinking it's just my allergies, I'm gonna be fine. So you really have to be proactive and vigilant than ever in taking preventative measures to safeguard your employees by educating and training them of the symptoms of COVID-19. And how do you want them to notify you if it happens that they don't feel well from home, or if they fail your employee self-screening? Who do they notify if they fail that screening mechanism? And also if someone doesn't feel good at work, what are the steps? Who do they notify? And do you have a place that you're going to have them sit? You might have seen on that policy and procedures, the isolation policy. Is there a location where someone can go and not be in a windowed office to sit so you can go through what happens next with someone who has tested positive? Some of our members don't have a room. You shouldn't really use your first aid room. You don't want to take over a nursing room. Some of them are using an employee's car to ask them the questions while they're isolating. And of course, we're all in a customer service mode. So what steps have you taken to safeguard your employees while working with the public? As we said, your branches are probably set up really nicely to deal with this prior to COVID-19 versus some organizations. But have you trained your employees on any new protocols? Maybe it's everybody takes that pen with them. It could be something that simple, but you might have to add that to your thank you for coming here today. You can have that pen. Train your employees on any of these new protocols to ensure that each customer receives the same great service, and everybody, both your employees and customers, feel safe after their visits. And we get a lot of questions on this, on business travel. So some of you may have stopped all non-essential business travel. What is allowed, what's not allowed. An example that we have for financial institutions is one of our members has stopped the sharing of employees amongst their branches. So they just said that's not going to happen anymore. You might have a leave or a vacation and you used to share employees. They're not doing that. You're now assigned to a certain branch and you're going to stay at that branch. Unfortunately, they have decided not to share employees. So I know it does set up a group of its own challenges because you were used to that and you could kind of move your employees around. But some of our members have decided to stop doing that. So it's not just traveling on a plane and going to another state. It could be just amongst your own facilities. Again, if anybody has questions, feel free to put them in the chat function or, just open your mic and let us know. So of course, communication, I'm sure you have been on top of this since about March 13th. It's been going on that we're in this emergency. We need to communicate to both your internal and external stakeholders. Is it just drive-through banking only? Who's working at what location? An emergency unfolds and organizations will just need to reevaluate your status and communicate the changes and next steps. And of course, you want to be transparent when you communicate and communicate clearly. This, of course, can ensure some calm by reinforcing the facts, letting employees know what your plan is, and hopefully it'll stop any rumors before they start. And this has been a really big topic at our roundtables. Some of you may or may not want to put in the chat function, but you're welcome to, is some of our members feel that their communication with their employees is better than it's ever been, and others feel like they're doing too much. So hopefully you guys are right in the middle. And it looks like Stephanie just posted the PDF of the slide deck into the chat function for anybody who would like that to take notes as we go along. And if any of you do engagement surveys of your employees, we have found that if this is the annual time of the year that you do it, don't stop. People are getting great engagement survey responses back. So we tell you, don't hesitate to continue with your annual engagement survey. So on this slide, I've communicated, put some things in here that help you communicate to your organizations. And then on the bottom half of it, I've given you ways to communicate. So one thing that's really important to note is that when you're communicating, keep in mind you have 3 audiences within your organization. So of course you have your overall company, you have individual departments, and you have your individual employees. So you've all probably heard of Zoom fatigue and all the other things that are going on. We recommend that you stop and think before you set up that Zoom meeting. Can this be done, number one, in an email versus having everybody on camera again? And or can it just be shrunk down? Do I really need all of these people to be involved? Can it just be a few people? And or maybe I could just pick up the phone and call that individual and talk to them. I think we all just got on the kick of virtual meetings and now we can't stop. So of course, one of your company's biggest assets is your talent. So you recruit them, you've worked hard to retain them, and of course, develop everybody. And this has forced many of our organizations to think of a new normal. So we're living in a virtual world, as we see here today, and organizations can adapt their recruiting process to include virtual interviews and virtual onboarding. So if you want to put in the chat function, yes or no, that you are hiring, just let me know. It'd be good to see what everybody's doing. Some people are actually hiring at this time. Some have put a hold on hiring. And some, I had one financial institution with, I think they're in a very small community. I think they had a total of 6 employees. And the poor HR manager, I felt so bad. She went through a medical leave since March. She's had a medical emergency leave. She has had a maternity leave, a retirement, and then a disciplinary issue. So at the end of the day, she had her and another person running the whole branch because she had all of these things happening during this pandemic. So she just had a little bit going on in her community. So one of the things you want to do if you are going to move into a virtual interview or onboarding scenario is take steps to evaluate, prepare, and test your technology. And I have some documents that if anybody needs, please let me know. I have documents on how to set up virtual interviews, and I have a whole check sheet for HR and for management on virtual onboarding. So I'm happy to share that with you. But make sure that when you do change into this virtual realm for interviews and onboarding, that you've tested your technology and reviewed your documents. So the documents that you used to use may need to be tweaked a little bit for this electronic communication with your candidates. And I truly believe that IT and HR can work together to make this process seamless. One of the things we are getting a lot of calls on lately is engagement with our employees, motivation. How do we motivate them during this time? So we just reviewed how to communicate and the importance of communicating. But remember, again, this is a great time to drive engagement. So if you've never done an engagement survey, you may want to do one to see what the pulse of your organization is. How is everybody coping right now? This is a really great time to do that. Remind your workforce how important they are to your organizations. In your industry, you may have had to redeploy your workforce, possibly. I'm sure there was a lot of PPP loans going on in the early stages of this. So maybe you redeployed people. So you want to remind those employees that their work and their contribution and switching and pivoting during this time was so important. And make sure you try and encourage your managers, whether it's sending them an article on how to do this, but encourage them to connect with your employees. And if you maybe have stopped switching employees between branches and there's some people that just miss their friend and then they're stuck at another branch, make sure you encourage them to reach out. And of course, you can always do virtual celebrations with the other branches and company chat boards. Both those chat boards can be on site, or we have a virtual water cooler in our Teams, Microsoft Teams. And of course, professional development, it's always ongoing. I know Stephanie does a great job with all the programs there, and it's time to just reimagine your learning in learning development during COVID-19. So both ASC, I know MBA, everybody offers some form of training. We offer virtual training and on-demand training on a vast array of subjects. So there's a lot of content readily available. And I'm sure myself and Stephanie can answer any questions on that if you have anything coming up. And in addition to virtual webinars and virtual training, ASC hosted their first virtual conference, our compensation and benefits conference, back in June for the first time. We also plan on doing an employment law conference and our diversity and inclusion conference in November. Actually, it's going to be a 2-day event. And one of the things that, again, I want to make sure I say is compliance. This is not a new word in HR, but it is critical for you to stay vigilant right now. You know, make sure you publish your plan, monitor the pandemic and make changes, and be very diligent with your employee record keeping, especially if you have conducted layoffs or you have employees on leaves. Again, if you're monitoring your employees' symptoms and recording anything to do with fevers, that is not to go in their personnel file. You must put that in. It's treated as a medical file. And there's no place saying that you have to keep that information. You could have them self-screen, and really the only thing you have to deal with is when there's someone that's positive. That's when you would have to do something with your health organization in your county. So some of your organizations may or may not have closed your lobbies. Some of you may have been able to stay open the whole time due to your geography because cases weren't high in your area. In either case, I'm sure there's many things that are keeping bank presidents and human resources professionals up at night on either reopening your lobbies or how to go forward. If there's bigger spikes in our area, should we close our lobbies down again? So now what? What do you do? The short answer really to all of your reopenings is to just assess and reassess and just be ready to pivot and change your plan. Create a leadership task force different than your COVID task force that goes with your plan that will represent your workforce, and kind of create a method that you can guide yourself in case the circumstances changes. So again, your guide should include your vision, your values, your methods, and any obstacles that you need to measure to reopen your business. So some of those methods that I had here were, we talked about them today, defining your new health and safety measures, your cleaning protocols, your business strategy. And thankfully, banking operations are in place so that you can do transactions online, via telephone, your drive-through window. You just probably need to create some strategies to safeguard your environment. And of course, I know a lot of you have done that with utilizing floor and wall signage inside your branches, markings, or other guides to improve social distancing. That can be done both inside and outside if you have the ATMs on the outside of your locations. Limiting the number of customers that come in the branch, maybe doing everything by appointment only in certain areas, reducing the number of teller lines. And we talked about eliminating furniture from your lobbies and chairs. And of course, you can have, we now have to require our customers to wear masks, but you could also use a greeter at your entrance too. So no doubt the remainder of 2020 is going to continue to be a little bit unpredictable for us all. So again, I want to give the floor back to you to see if you have any questions. Please go ahead and type them into the chat function. This is just a quick snapshot of what ASE has been doing and how we've responded. I know I go on the MBA website often, so I know they've been very busy too, giving you all different COVID updates and allowing you to get through and navigate this. So these sites that you'll have in the slide deck, these are available. These are non-member sites that you can go in, and they'll help you with all the different resources. This facts page that we have, the facts page is great. This has a search engine to it. You can go in and type, whatever your question may be, and we can give you the answer right there on the site, but you're more than welcome to contact me too. We talked about professional development, and we do have a couple of partners that offer on-demand training. So these are nice videos that your employees can use at their convenience at a time that works best for you and your staff. And we can always connect you with the representatives there. So again, I want to thank you for having me today. We have about 15 minutes left. If there's any questions or any open forum that you would like to discuss, but I know it's a lot of information, but hopefully we've been able to narrow it down for you. And again, if there's any policies or procedures that you would like me to open up, I can do that too. I can show you our toolkit, and we have all of our policies listed there.
Linda?
Yes.
Can I just, can we just recap over one of the things that you had talked about, just to make sure I got it clear? I know I can listen to the recording over, but this is Bonnie from Donnelly Penman.
Yeah, hi Bonnie.
Hi, good to see you. It's been years.
I know, it's been a while.
Yes, it has. Tell Ed I said hello.
Yes, I will.
Thank you. All right, so when you talked about people coming, like we do a daily screening, and so you're saying then for this plan that we're putting in place, we have a plan where people come in and they have to do the self-screening, and then they submit that form, and I actually receive the email. I don't need to keep that for files unless there's something that was filled out that indicates they can't enter, so to speak, or
right,
going to stop them. But you're saying in your conversation, you said we don't need to keep any of that on file at all. So
no, and the best thing to do with it is what you're doing. So you're the sole person,
correct,
that's seeing it. So it's meant to be confidential.
That's what
it's meant to be treated like a medical record. So as we all know, our medical records are not in our personnel file.
Right.
They're completely separate, should be under lock and key. So yes, definitely if you're putting it up in the cloud, you should be the only person who has the access to that too.
Okay, and then the last thing is, just to recap, when to understand the CDC being in close contact with anyone. So when people come into the office, if they went to an event over the weekend, whether that was church or whether that was a wedding or anything like that,
right?
And a few days later, they found out that someone at the wedding tested positive for COVID.
Okay.
They were not sitting at the table with them. They were at the event. They do not need to say that they were in close contact then.
No, exactly. So the CDC defines close contact as
15 minutes.
15 minutes under 6 feet apart. So basically, if no social distancing measures were in place and the person who has tested positive, you were not socially distancing, you were not wearing a mask, you were spending hours sitting next to them at a bonfire, singing songs and, having a beer or whatever it may be, you were probably pretty close then, right? If you're sitting right next to someone. But if this person was at a wedding and the said, so usually it's confidential, you don't know who it was, but in this case, they possibly could know and could be like, oh, I don't even know who that person was. I don't even think I was sitting next to them the whole time.
Right.
That would be different.
They don't have to answer that. Okay, or they don't have to say yes.
And typically, if you're in a situation like your office is smaller sized and you may all have individual offices. So it also helps too, if that person could come back and stay in their individual office. And if you're in your situation, they may be able to work remotely for even 5 days.
Right. Okay, so then
if they feel necessary.
Yeah, so then what we want to do going forward is we want to set an app on our iPhone so that anytime we come in contact with anytime we come up to a conversation, we set the timer, so it's kind of like people that's wanting to track somebody's phone. Well, with 30 seconds, we have to shut off before we...
Yeah, I got to go. Bye. Well, to be honest with you, I have an Android phone, but if you go into your settings of your phone and type in COVID-19, I think it was about 3 or 4 weeks ago now, there was a contact tracing mechanism put onto everybody's phones, unbeknownst to us. You have to activate it, but it was downloaded into your phone system about a month ago by.
All right, so go to settings and do what?
You just, there should be a search bar in your settings, at least there is in
Yeah, there
Android
is.
phones.
Yep.
And if you type the word COVID, I believe COVID notifier will pop up.
That is unbelievable.
You do have to turn it on, but it's there now. About a month ago, maybe 3 weeks ago, a bunch of people were saying they were having issues with their phone, and people believe that this was being updated and downloaded onto the systems, and that's why.
Yeah, it's for the Apple, it's COVID-19 exposure notification.
And it's on my Android phone too.
That is amazing. Well,
at least it gives you the option to turn it on. So it wasn't like completely 100% Big Brother, but it's there.
That's great. Thank you so much. Great.
Yeah,
great
absolutely.
today.
Oh, good. If you have any further questions, Bonnie, because I know sometimes like you end a webinar and 10 minutes later, you wish you would have asked something. My email and everything's in your slide deck, so don't hesitate to give me a call or email.
Thank you so much.
Absolutely. So I'll open it up. I'll just, gonna break out of this real quickly, and I'm gonna show you guys our, there we go. I think you got to see my dog for a minute there. That's Mac. And he's been very good, thankfully. He's quiet. But this is, let me know if you can see our Contagious Disease and Pandemic Toolkit. Is that up on your screens?
Yes, it is.
Okay, perfect. I just wanted to make sure. So this is something that we've created for our members, but of course, if you see any policy here that you guys would need, let me know. But this is something that's on their dashboard that they can get into. We have a complete response plan template that we created for the members at ASE. And then all of these documents that you see here can be opened and edited. So you can go in and put your own company name, if you call yourselves colleagues, if you call yourselves team members, whatever it may be. And you can see we also then added some vendors for different things that people need right now that they may have never had to order before. And then of course we put a bunch of different links here for everybody.
Linda, do we have to have an account with ASE to be able to log into this?
You do. This is a member only piece, but I'm happy if you see one or two policies that you need. And of course, if any MBA members ever do want to become a member of ASE, we have we always give them a special offer. And for instance, if we have classes or anything that anybody would ever want to take, we always give them the ASE cost. Recommendations for monitoring visitor health screen. Okay, great. So I'll open up that policy for you. And you can screen your visitors with a temperature controls too. You are allowed to do that. And you can even screen, you can have, if you have certain people who come to your office often, but they're not from your company, you could have them do something in advance too. You could actually create a frequent visitor form on your Microsoft's form and give your visitors their own QR code. So this is a sample document that you could use, and Kimberly, I'll send this over to you, or I'll send it to Stephanie to get to everybody. So it's really simple, but I also recommend this to continually be monitored. So for instance, here in, I'm in Grosse Pointe right now. So in the Grosse Pointe area, about end of June, there was a huge link to that Harper's Bar situation in Lansing and parties and things going on in Grosse Pointe, Michigan. So I had a couple friends that are business owners in the Grosse Pointe area, and I've kind of been consulting them a little bit. They called me and said, I don't know what to do. Should I shut down again? It's gotten really bad. We had a big uptick. And I basically explained to them that you can change your visitor screening form. If you want to ask someone, have you been to Harper's Bar? Have you been to East Lansing? Have you been to Miami Beach, Florida? And they were in your location last week and you didn't ask that question, that's perfectly fine. You can change this as often as you want. So the governor is talking today at 2 o'clock. If there's something that happens when she talks at 2 o'clock and you need to change your form again, you can do that. You can change it as often as you'd like to. Just make sure the questions you're asking regarding to symptoms and taking their temperatures remains part of the EEOC guidelines. That would be the biggest thing. You don't want to violate ADA. And I'll go back to that list. So if there's another form that anybody would like to see or have opened up, I'm happy to do so. Some people are also putting an iPad stand in their lobby for visitors to do the same form on an iPad. So you can create a Microsoft form, you can have the QR code, and for some people who maybe don't have, want to put it on their mobile device for whatever reason, you can allow them to do it on an iPad in your lobby too. Or do it the old-fashioned way and have someone come out and monitor them. So let's see if there's any more questions or anything that you need sent to you. I know we gave you a tutorial on how to do Microsoft Forms. It's in the chat function. We gave you the whole slide deck, and also I gave you the article on how to handle summer vacation, so you have clarity on how to assess leaves, especially if someone just gets back from vacation and now they need to take 14 more days off. Hopefully that's not the case. So I may have answered all your questions, apparently. Well, that's good to hear. Well, again, everybody, I want to thank you for having me today. Stephanie may be on another call, so I'll just wrap up the webinar for everyone. But you do have my contact information. Please feel free to use it and reach out to me. I know it's a lot of information and it's changing constantly. So don't be embarrassed to reach out and just ask the question, because it's best that you get that second opinion and do things properly. So great, I think that's everything, it looks like, from, since there's no more questions coming in. So I just want to wish everybody to have a great day. Say hello to everybody, Bonnie.